Welcome to this explainer. If you or a family member are gearing up for cataract surgery here in Ontario, the healthcare system can sometimes feel like a giant, overwhelming puzzle. But honestly, it really doesn't have to be. Today, we're going to use this explainer as your personal, highly structured roadmap through the whole process. We're breaking down the clinical pathways, the choices you're going to face, and exactly what you can expect when it comes to the financial side of things.
So let's just address the elephant in the room right off the bat. How much is this actually going to cost you? It's completely normal to feel a bit of financial anxiety here. There's a ton of confusing noise out there, especially when you start trying to figure out what the public system covers versus private out-of-pocket upgrades. Well, we're going to demystify all of that today, giving you the facts so you can walk into your doctor's office with total confidence.
To clear things up, here's our roadmap for today. First, the surgical journey. Second, the co-management pathway. Third, decoding OHIP and costs. Fourth, standard versus premium lenses. And wrapping up with the Ontario drug benefit.
All right, let's dive into Section 1, the surgical journey, beyond clear vision.
Look, cataract surgery is about way more than just fixing a blurry picture. Sure, restoring optical clarity and vibrant color is the main goal, but the ripple effects, they are huge, especially for folks in their late 70s. Getting that contrast sensitivity back drastically lowers the risk of dangerous falls on stairs or uneven ground. And let's talk about autonomy. The Ministry of Transportation has strict rules for Class G drivers in Ontario. You need 20/50 vision. This surgery is often quite literally the key to keeping your license and your independence. And, as we're going to see a bit later, it even fights off social isolation.
Moving right along to Section 2, the co-management pathway, a team for your vision.
I really want to reassure you here, you are absolutely not navigating this medical maze alone. The beauty of this system is that your care is a continuous loop that starts and ends right in your own community. Step 1 is your local optometrist. They handle the diagnosis and counseling. Once you're ready, they hand you off for Step 2 to the ophthalmologist, the surgical specialist who does the exact measurements and the actual surgery. Then, boom, Step 3, you are right back with your familiar optometrist to monitor your healing and fit you for any new glasses.
Basically, think of your optometrist as the quarterback of your lifelong eye health and the ophthalmologist as your highly specialized precision interventionist. Your optometrist is your primary gateway. They know you and they know your eye's history. The ophthalmologist just steps in to do the heavy lifting, measuring the exact axial length of your eye and actually doing the surgical intervention. It's a brilliant co-management model that leverages the intense precision of a specialist while keeping the convenience and familiarity of your local eye doctor.
Okay, Section 3, decoding OHIP and costs, what you need to know.
Now, this is where we really need to pay attention. It all comes down to how the province separates medical necessity from elective lifestyle tweaks. Think of your costs in two distinct buckets. On the OHIP side, the fully insured bucket, you are completely covered for the standard diagnostic testing, the standard ultrasound surgery called phacoemulsification, the standard monofocal lens, plus all the facility and anesthesia fees. You literally cannot be charged for these. The out-of-pocket bucket, that only happens if you choose elective upgrades like laser-assisted cuts or premium lifestyle lenses so you won't need glasses as much. But the core surgery, the IV sedation, totally, 100% covered.
Actually, before we even touch on lenses, we need to completely squash some major myths. Sometimes predatory marketing makes people think the free OHIP-covered ultrasound surgery is somehow basic or substandard. Nope, absolutely false. Traditional ultrasound phacoemulsification is literally one of the safest, most effective procedures in all of modern medicine. Oh, I'm queue jumping? Paying cash to skip the line? That is strictly illegal in Ontario. The system is built to ensure that your medical need, not your financial capacity, dictates your care.
Let's move to Section 4, standard versus premium lenses, choosing your lens.
The artificial lens you choose is arguably the biggest, most critical choice you'll make because it directly dictates your daily lifestyle after surgery. The standard monofocal lenses, the ones OHIP fully covers, are fantastic. They give you pristine optical purity and great contrast. But they focus light at a single distance, usually far away, so you're definitely going to need reading glasses for a menu or your phone. Premium lenses cost out of pocket, but they can correct pre-existing astigmatism or use multifocal tech to give you a whole range of continuous vision. It's essentially paying for spectacle independence.
But wait, there is a massive caveat here that we have to talk about. If you have pre-existing eye conditions, specifically moderate to advanced macular degeneration or glaucoma, premium multifocal lenses are a huge no-go. They are strongly contraindicated. See, multifocals work by splitting incoming light, which naturally drops your overall image contrast.
If your macula or optic nerve is already struggling, you literally cannot afford to lose any of that light. You need 100% of it channeled to one single point. So for these patients, standard monofocal is absolutely the way to go to preserve vision and keep you safe.
All right, wrapping things up with Section 5, the Ontario Drug Benefit, post-operative care.
So OHIP covers the meds during the surgery, but what about your take-home recovery eye drops? That's where the ODB steps in. If you're an Ontario resident 65 or older, you're automatically enrolled in the Standard Ontario Drug Benefit Program. Once you clear a tiny $100 annual deductible, your prescription copay is capped at a maximum of just $6.11. That's it. $6 and change for high-powered antibiotics and corticosteroids to make sure your healing phase is safe and incredibly affordable.
And actually, it gets even better for lower-income seniors. If your individual annual net income is $25,000 or less, you qualify for the Seniors Copayment Program. That $100 deductible? Gone. Waived completely. And your maximum cost drops to exactly $2 a prescription. The province set it up this way so that absolutely everyone has access to safe, proper post-operative healing.
Now, to bring this explainer full circle, I want to jump back to those profound secondary benefits we talked about right at the start. Get ready for this, because it is wild. According to the Adult Changes in Thought study, older adults who undergo cataract extraction exhibit a nearly 30% lower risk of developing all-cause dementia and Alzheimer's disease. 30%? And that protective effect lasts for over a decade. It all ties back to the sensory deprivation hypothesis. Your brain desperately needs high-quality sensory input to maintain neural plasticity. By clearing your vision, you literally lift a massive cognitive load off your brain, actively keeping your mind sharp.
Which brings us to our final thought today. If you knew that clearing your vision wasn't just about reading fine print or driving comfortably at night, but that it could actively protect your cognitive future, isn't it time to start this journey with your optometrist? You've got the roadmap now. You know the exact costs, you know the clinical pathway, and you know the tremendous benefits waiting on the other side. Take that first step and book a consultation. Thank you so much for joining me for this explainer, and here is to crystal clear vision ahead.